Hello, everyone, and welcome to the first edition of the Diabetes Care Summit. I'm Dr. Barbara Akimbua, and I'm your health buddy. This summit is for you if you've been diabetic for a while and you've been struggling with keeping your blood sugar controlled, either because you have problems knowing what to eat, when to eat, how to eat, what else you need to do to keep healthy, or you do know these things, but it's difficult to be motivated. It's also for you if you have an elderly parent who is diabetic that you care for and you find juggling medications, clinic visits, meals, and then illnesses in between overwhelming. Or you're a beautiful married woman and all you would love to have is a normal pregnancy and delivery. And instead, you keep having miscarriages and stillbirths as a result of complications of diabetes. Or it could be your husband. He is the one who's diabetic. And during sex, you have problems. It's either most of the time he can't get it up, or he has other problems while you're having action. It's also for you if you're a health enthusiast and you believe that prevention is cheaper and better than cure. And so you'd like to learn anything you need to know to stay healthy. During this summit, you listen to loads of interviews by different specialists, including myself. Some of the interviews are short and some are not so short. But I'd encourage you to watch each video till the end because there's loads of important health information and you're getting it all for free. So, once again, welcome to the Diabetes Care Summit. And don't forget, I'm Dr. Barbara Akimbua and I'm your health buddy. See you on the healthy side. A lot of the time, diabetic patients need to see different specialists. When your diagnosis is made, you are told you should see a dietitian. Sometimes you have to see a cardiologist. Sometimes you need surgery. You have to be sent to see a surgeon, or you have problems with your eyesight and you need to go and see an ophthalmologist. So it can be overwhelming because it's like, when you take your car to the mechanic and they say it's an electrical problem, you need to see an electrician, or you see body work, you need to see a panel beater, or something else. So how do we put everything together? How do we make everything work well so that at the end of the day, you get the best for you without having to go through all that stress? Because if it's not coordinated, it can be really, really stressful. So today I'm going to be talking with a colleague of mine. We were classmates. I'll let him introduce himself and tell us what he does.
Okay, so thank you for having me. I am Dr. Odo Gabriel. I'm a consultant endocrinologist with the Just University Teaching Hospital. I've been involved in diabetic care for close to 9 years now. Thank you very much.
Okay, thank you. So what is an endocrinologist? What does that mean? It's a big word.
Okay. So I'm involved in an aspect of medicine that take care of people that have problems that is related to diseases that are particularly concerned with what we call hormones. For instance, in endocrinology, the pancreas, which is an organ, within the stomach, I would say, literally, produce a very important hormone, and this hormone controls our blood glucose. Once we eat glucose in the blood, the hormone regulates it. So that aspect of endocrinology deals with what we call diabetes. And we also see other conditions like having growth in front of your neck. It's called a thyroid disease. Also, it deals with hormones, another hormonal condition. That's what an endocrinologist does, essentially.
Okay, so thank you. So an endocrinologist deals with diseases caused by hormonal problems or problems with hormones in the body.
Yes.
And diabetes is one of such diseases.
Diabetes is a major disease.
Okay, so when you are treating a patient with diabetes, what is the goal of the treatment? What are you trying to do for the patient? What is the end goal?
Diabetes is a condition in which the body have problem with controlling glucose in the blood. Okay, so what we do when we treat people with diabetes is to make sure that we, control the glucose to levels that are normal, that the body can tolerate. The other goal is to also ensure that by doing the first thing, by controlling the glucose, we ensure that the people don't develop complications. Because if you don't control the glucose, people can have complications affecting the eye, the kidney. They can have wounds that will not heal. Essentially, that's what we do to make sure that we control the glucose, to make sure that we prevent complications, to also make sure that people live, life, close to normal as possible. That's what we do once we approach people with diabetes.
Okay, so there are three goals from what I hear you've said. The first one is to control the blood sugar. The second one is to ensure that they don't develop other problems in other parts of their body from the high blood sugar levels. And then the third one is to help them live better, healthy lives, essentially. Okay, so what are the problems that patients have adhering to a treatment plan? So when you see a patient and you say, okay, this and this and this is what you need to do, what problems do they have following that?
Some of the problems they will have is usually when their glucose is not controlled to normal levels. And this can translate to a lot of problems. Complications can arise. People with diabetes can actually have problems with their eyes. Some can actually go blind. People with diabetes can have problems with their kidneys. Some will need even kidney replacement therapy like dialysis. People with diabetes can have a lot of infections because diabetes is a condition that, predispose such persons to developing, different forms of infection. Another major problem they can have is, wounds. Once they sustain wounds, these wounds don't heal on time. And you see a lot of people walking around with, without limbs, amputation, for instance. Most of them are actually due to diabetes. Psychological problems, people, because of the perception of the patient, some patients believe that once you have diabetes, you're about to die. So a lot of our patients are depressed. A lot of our patients feel not too important in the society. So that leads to a lot of psychological problems. So the problem is actually all encompassing. A lot of things can result from not, controlling people's blood glucose.
So so the patients have a lot of things to deal with because they can develop other problems and they are nobody likes to hear that they have diabetes.
Yeah.
So what problems, what makes it difficult for you to help these patients? What are the challenges you face when you are managing patients?
Okay. Some of the challenges that we face, largely deal with issues of perception. Some patients, immediately you diagnose them, they already feel defeated. They feel they are going to die, possibly from what they see, around. Maybe people dying from diabetes because of lack of control and all that. The other problem we have, especially in our society like ours, a developing nation like ours, a lot of our patients are unable to afford the care for diabetes.
Okay, so from what you've said, there are two major problems. The perception, they feel depressed, they feel they are going to die, so they are not even motivated to practice any of the things they are told to do. And then money, finance, paying for their treatments. Hi, have you heard of Soyo, the new diabetes care app? Studies show that the best medicine to take for diabetes is to get education about it. Because if you understand how it affects your body, you'll know better what you need to do to fight it. It will also help you to take care of someone else with diabetes. With the app, you don't just get education, you also get to make your management plan either for yourself or the person you're taking care of. There are also lots of other features like meal plans, medication, and other reminders to keep you on track. And if you fall off, don't worry, just get back on. This is how families can live healthy and happy with diabetes. Don't be left behind. Download the app at soyo.web.app to care for yourself or someone else with diabetes. What can patients do to solve? Because I know diabetes is not a death sentence, and I'm sure you know that. So, what can patients do to help themselves so that they can surmount these challenges?
Okay, so from my practice, from my experience, what I think help a lot of our patients is health education. Most patients, once they are properly educated from onset, from their diagnosis, you tell them about diabetes, you remind them of the fact that diabetes is not a death sentence, and you remind them that a lot of people, celebrities, sportsmen, important people in the society live with diabetes and they don't have, any problem. You educate them about diet, for instance, which is very important in conjunction with exercise, and then also remind them of the importance of taking their drugs. You see a lot of patients doing very, very well. The ones I mentioned earlier are the ones that, we have challenges with. Some of them are real because, even with your advice and all that, some will need, the degree of treatment in diabetes varies. Some may just need the exercise and diet, actually, a few of them. Some, the medications you give them may not be so much because of the level of their diabetes and the level of complications they come in. Some will need so much, some will need both the oral drugs and the injections too. So some will not cope because of the degree of the commitment that is required from them. But a lot of our patients, actually, even in a developing setting like ours, are getting better because, some few years back when we were in school, a lot of our patients would die from diabetes complications, the emergencies when they come, But we're beginning to see, even with some studies that we did recently, that actually our mortality rate have dropped significantly, even with people that are coming with complications. And you see a lot of our patients living very long. You see a lot of our patients in the clinics without any complication. So, by and large, I think we're doing well. It's just that in a society like ours, we still have a lot of people who can't afford, the treatment.
Okay, thank you. So things are actually getting better, but we need to, education is important. And for what you've said, different patients need different levels of care, depending on how early the diabetes is or how late, how long they've had it for. So when patients come and they need to see different specialists, that is called a team approach. Why is a team approach important? How does it help?
So now the team approach is very important because diabetes is a disease. A lot of people, when we think about diabetes, we think about the glucose, the sugar. A lot of people think it's just a sugar problem. But from what I've said so far, you can see that diabetes, leads to a lot of things. Apart from the sugar, we talk about controlling the sugar. But people with diabetes, for instance, someone with diabetes from the perception can get depressed, can have some psychological issues. So you will see that some of them may need, psychology to talk to them. And if you look at some of the results of having blood glucose elevated for so long, people can have complications that involve the eye, the heart, the kidney, skin, that's when you develop wound, and even the bone. So, you can see that with that, we will need other people, to effectively treat people with diabetes. If it's affecting the eye, for instance, you need an ophthalmologist. If it's affecting the kidneys, you need a kidney care doctor. The skin, for instance, there are wounds, you need a plastic surgeon, doctors that take care of wound. Or if it's affecting the bone, we need, an orthopedic surgeon, to help. Then, I've talked about education. Education in diabetes care is very important. Now, an average doctor here in our setting, because the endocrinologists in Nigeria are not enough, an average doctor will see a lot of patients at once. So it's difficult to say you're going to educate every patient that you see. So we need diabetes educators, which are not very common, even though it's not supposed to be a big thing, but they're not very common in our setting. So sometimes we educate our nurses to give such education. So that should be part of the team. You will need nurses, for instance, that should also be part of the team. You need doctors at different levels. You need family physicians, for instance, general practitioners. And the reason for that is clear. Like in our setting, we have a lot of cases that don't even come to us because the numbers are so many. And most of the endocrinologists in Nigeria are just concentrated in the cities, the teaching hospitals, the federal medical centers, and not all teaching hospitals or federal medical centers. So if you go to the local government, you go to the rural areas, there are a lot of people with diabetes. So, other doctors are very important. So it's a very, very big, it's a big teamwork. If you talk about the teamwork, I'm excited because if you have all this on ground and you educate people and we're able to work together. In some African countries, for instance, if you come to a typical diabetic clinic, which I know about, you will see the endocrinologist, the cardiologist, the surgeon, the vascular surgeon, orthopedic surgeon, they are just around the same vicinity. So that as the patient is seen, you can talk to your colleague, they will see the patient immediately, and that will be very, very effective in terms of results, which we don't have here, even though we still refer our patients and all that. So teamwork, I think, is very, very important, for good results, for good outcomes, in our patients with diabetes.
So I'm excited with what you've said because teamwork is actually very important. And I know part of the difficulty is different specialists are in different places. So there might be an endocrinologist in a different town from where the patient is, but the patient is seeing a family physician. The patient might have to go to another hospital to see a cardiologist, might have to go to another hospital in another city to see a kidney doctor or whatever. So how easy is it to coordinate that care when they need a team, when teamwork is needed? Because the team members need to talk to each other so that they can give the patient the best. What are the challenges with that now?
The challenges are obvious in settings like ours. Probably in a teaching hospital, that is achievable because if you in a typical teaching hospital, you have most of the specialists on ground. But if you look at Nigeria generally, most of the hospitals are actually far apart, like you alluded to earlier. When the teaching hospital just to talk to each other and maybe involve the management to set up a specialist, a multi-specialist diabetic clinic, like it's done in I think a friend in Ghana has intimated me about that, and it's working. So it's all about talking to colleagues, talking to the hospital management, and that is achievable in the teaching hospital setting. I'm afraid in other tertiary centers in Nigeria, that will be very difficult because they are still struggling with, having different specialists, even to take care of the basic needs of the particular specialist. And then if you look at government, other rural areas in Nigeria, you can imagine what the challenge will be. And even within the specialists, you will see, for instance, for a diabetic patient, for instance, that have a kidney failure, that may need things like dialysis or transplant. Okay. In Nigeria, you can also see that we don't have a lot of centers that even do dialysis. Dialysis like basic. Okay. I talk about transplant, some of them may need to travel or 1 or 2 centers. So that's the challenge that we see. Eye complications, for instance, some of them they may need some specialized procedures like photocoagulation, for instance. Not many centers that do ophthalmology do that in Nigeria. So that's a big challenge, in our setting.
Thank you very much. So a team approach is very important for the patient. We've talked about the specialists and the doctors or the health team that they need. What role does the family have to play? Or is the family not part of the health team for a patient?
Okay, thank you so much. Yeah, probably skip that. Family support is very important for us in diabetes, okay? Because just like any other thing, like if your family is with you, they encourage you, they talk to you, they're with you in everything, it will help. For diabetes, apart from the psychological boost the patient will get from every family member, understanding with them, cooperating with them in terms of their diet, seeing through their problem. Sometimes, like administration of insulin, for instance, family members help to give some patients that may have, eye problem. Now, I talked about finance earlier. Finance is very important in our society. So, if family support includes, providing for a patient, probably children of a parent or siblings, contributing, it will help. So if you look at it in totality, family support is very, very important. The other aspect of family that is important in our care is that once we treat these patients, sometimes they go into some acute problems. Sometimes the glucose may be very low in what we call hypoglycemia. A family member around that sees that can easily help, by administering any glucose supplements around all that. So family support is very, very important. And the patients, once they know the families are with them, they're supporting them. Psychologically, you see them very, very, they're encouraged, and outcomes, I believe, it's also good family support.
Okay, so the health team involves the family and the specialists that are treating the patient. Okay, so it's a big community. Yeah, all the specialists in the hospital, the nurses, the pharmacists, the different specialist doctors, and the family members, and the patient who is the VIP in all of this. Okay, so when a health team is working properly, who is responsible for prescribing the medicines for diabetes? So the patient is taking diabetes medication, but in our practice, you see a patient today, maybe he gets ill, he goes to see another doctor, he goes to another hospital, or he goes to a chemist, and his medications are changed. When there's this saying, too many cooks spoil the soup. Who is in charge of the diabetes medication? Who should all these specialists, how do they balance it? Because they need to be talking together, they need to work together when they have concerns. So at the end of the day, whose responsibility is it to manage the diabetes?
I think the endocrinologist should be the person that to the patient. Now, when the patient has complication, like you said, communication is just key. One specialist talk to themselves. Your patient have a kidney problem, for instance, they're supposed to be in touch with a nephrologist. Once you talk to each other, like in my setting, we talk a lot, sometimes even on the phone. Okay, this is your medication, this is what I'm going to do. this is a GFR, for instance, or this is the level of the kidney problem, for instance. This medication, is this safe and all that? So I think once there's effective communication, there shouldn't be problem. But I'm not saying that we don't have challenges, because, honestly, sometimes you see a patient, another specialist is seeing, he doesn't talk to you, he continues the management until he runs into some challenges. So I would rather say that we encourage that in a teamwork, there should be communication, there should be respect. People should talk to each other with some level of respect. And I think the team will work very, very well.
Thank you. I'm happy to hear that, because nobody is an island and nobody knows everything. Nobody has all the knowledge. So it's important to talk to each other in the team, because one person will see something that another person hasn't considered or another person hasn't seen. And then once communication is done effectively, then the treatment can be tailored appropriately so that the patient gets the best. So the last question: what advice do you have for anybody that is diabetic or their family members about their care?
Okay. So my advice, usually, that's what I say in the clinic. At the end of my review, I always tell them that diabetes is never a death sentence. I encourage them, remind them of important personalities in sports, people that act movies, that are living today with diabetes, some that play football actively. And once I do that, I see, a change in their countenance, see them very happy, and they're encouraged. And most times, once you tell them that, because you need to motivate the diabetic patient, that's the truth. Once you do that, they are with you. Because you as a doctor, if you just think that it's just all about you in care for diabetes or any other disease condition, you're wasting your time. But the patient is the one that would take his drug. The patient is the one that would choose to eat what he wants to eat. The patient has to listen to you to do the exercise and all that. So you have to work. Your patient have to be your patient. You people have to be together. So once you encourage them that way, they will be open and you'll see results. You'll see results from your care. So I advise patients with diabetes to be excited, because we have a lot of people that are living with diabetes that, if you look at them, they're even looking healthier than you, the doctor, because they take the medication, they are motivated, they're encouraged, they don't have any complications. And besides, we have few patients, I always like to say this, we begin to see patients that even we start with medications and we have removed all the medication, and their control is still very good, though very few patients. So there's a lot of hope, I think, in diabetes care.
Thank you so much, Gabriel. So you've heard it all. The diabetes patient is the VIP here, is the important personality. And the goal of treatment is to normalize their blood sugar, to prevent them from getting other problems, and to ensure that they live healthy, happy, long lives. And there is a team approach to this, which involves the doctors that are treating them and their family members. But at the end of the day, what we want is a healthy, happy patient. So thank you very much for listening, and I'll see you next time. Thank you, Gabriel. I'm glad you took my advice and watched the video till the end, and I hope you learned a thing or two. So don't forget, watch the next videos, because there's still lots of information that will be really beneficial to you. Don't forget soil.web.app. Download it now. See you in the next video. Bye.